Introducing the doctor who thinks outside the box, Dr. David Peterson.
In order to understand the subluxations of excess motion, one must first understand controlled vertebral motion. First, proprioceptive muscle spindle fibers detect movement when stretched. Second, sensory neurons conduct action potentials to the spinal cord. Thirdly, sensory neurons synapse with motor neurons. 4. Action potentials to vertebral muscles stimulate contraction or resistance controlling vertebral movement. This requires proper vasomotor control for delivery of oxygen, muscle control of the vertebra, blood-nerve reciprocity, nerve function, and normal visceral function. Visceral dysfunction leads to vasomotor dysfunction with hyperemia of the blood vessels supplying the spinal cord at the vertebral level associated with the impaired viscera. This excess heat in the pedicle-lamina junction causes a reflex response from the Ruffini spray endings, altering the proprioceptive information, controlling vertebral movement, leading to a lack of controlled motion and a trap fiber response. Trap fibers have two functions: skeletal pain and reactive reflexes. Hyperemia causes pain at the vertebral level associated with the viscera in vasomotor distress. Do not expect these to be painful using the pressure recommended in Dr. DeJarnette's seminar notes. A reactive trap fiber will start mounding, enlarging, and pushing back against your thumb as you palpate it. The trapezius fiber contains two types of palpatory findings: a flat fiber that is painful when palpated with the recommended pressure, and the reactive fiber which mounds up with continued pressure for 10 seconds. The skeletal pain fiber lies flat, does not mound, and its size remains constant. This fiber is always associated with the vertebral segment that has lost controlled motion, resulting in compensatory muscle spasms and pain. The reactive mounding trapezius fiber is always associated with the pedicle area of a specific vertebra, and an X-ray will demonstrate changes in the pedicle-lamina density. The painful trapezius fiber does not need trigger point treatment, as both skeletal and reactive trap fibers are diagnostic and not therapeutic. High bone loss is associated with hyperemic vasomotor responses. Hyperemia in the spinal canal causes a Wolff's Law response in the pedicle-lamina junction. The increased blood flow brings immune cells to the area, increasing inflammatory damage to the structures of the bone, disc, and ligaments of the vertebra. There is a strong relationship between gut inflammation and bone spurs, degenerative discs, vertebral body, and facet joint erosions. Studies have reported that remission of the joint inflammation was always connected with the disappearance of gut inflammation, whereas the persistence of joint inflammation was always associated with the persistence of gut inflammation. This all starts with visceral dysfunction, resulting in vasomotor dysfunction not only around the viscera, but also at the vertebral level associated with the distressed viscera. This hyperemia impairs the blood-nerve reciprocity, resulting in impaired nerve and muscle function with impaired proprioception and a loss of controlled vertebral motion. For more information on reactive trap fibers and functional organ rehabilitation, check out the Functional Spinology website, www.masteringthegut.com.